previous meetings. We're looking for the per diem line to increase by $70,000, and we would take it from our fees for service, and $45,000 to be put in a newly created line for our wellness benefit.
Do we have any questions from the committee, Mr. Moriello?
What is a health and wellness stipend account? What is the stipend used for?
Well, we're in the process of developing guidelines for that and getting approval from State Health Department. Typically, other wellness programs offer gym memberships and counseling, nutrition counseling, weight management programs, or a variety of other things. We cannot give specifics yet until we get the approval from the State Health Department on exactly how it can be used, but we anticipate doing things that promote health and wellness within our own staff.
Within our own staff?
It would be for
Okay,
staff
for
members.
county employees.
Right.
All right, thank you.
Mr. Ward?
I'm all for this. I think it's a great idea, but doesn't the insurance companies reimburse for the health insurance?
They do, they reimburse for some things, and so when we were in the process of drafting the wellness guidelines, we specified what things were already covered by currently existing insurance, and then things that weren't, so we would not obviously duplicate any of those
Would be
things.
supplemented.
Exactly.
Okay.
Do we have any other questions from the committee? Hearing none, can we get a motion to move?
Motion.
Seconded by Mr. Ward, seconded by Mr. Collins, all in favor?
Aye.
Any opposed? Unanimous. We do have one item for the health department that we'll take out of order. It's not on the agenda, it's number 8.
Thank you. We are requesting authorization to apply for a grant through the New York State Homes and Community Renewal. This came to our attention less than a week or so ago. Unfortunately, the deadline to apply is December 15th, and so we apologize for getting this on the agenda late. But basically, it would allow us to receive upwards of $1 million, $1.136270 in funding, and it would provide us the opportunity to give mini grants, if you will, or provide funding to landlords to improve their homes, increase or to abate or make the units more lead safe. This would only be available to landlords of multi-unit dwellings. It goes hand in hand with the new legislation that will be enacted next year, whereby any multi-dwelling unit of 2 or greater will have to attest to having lead-safe apartments, and this will allow some funding to be out there for those folks to remediate their apartments. It goes hand in hand with our other 2 lead grants. I should say only local governments can apply for this funding, and we would certainly partner with housing and community development agencies to help us administer this.
Mr. Moriello?
In your memo here, it says 5 zip codes have been identified within the city of Albany. Is this the only place where this grant is going to be available?
It will only be within those 5 high-risk zip codes. That's correct. And the bulk of them are Albany City, I think, if not all.
It said has 5 identified zip codes where the funding can be utilized.
Yep, I can tell you
So
which
it's all
ones
the same.
they are. So it is 12202, 12206, 12208, 12209, and 12210.
Okay, thank you.
Is that because of income?
It's based on the number of lead-poisoned children within the
Okay.
communities. So we take a look at where the kids are located that have elevated lead levels, and we target those particular homes.
Mr. Miller?
Frank, you took one of them, which is good, appreciate it. But is this paint, pipes, both, and any lead?
It is any lead,
Okay.
yeah, yeah.
All right. So would we, I don't know if getting too far ahead of it, because I know there's a lot going on in Troy in particular right now. Would there be pipes coming into the house, or would they be replacing pipes in the house?
I'm not sure. You think it's surfaces, but
Yeah,
I'll leave that to you.
Yeah, I believe it's just surface abatement.
Okay, all right.
It's
pipes are a big
Rensselaer
deal,
County
but-
does have $711 available to them, just in case you're interested, in Troy, 12180.
No, I just know over there they're doing a lot with pipes
Oh,
right now, so
okay.
I didn't know if
Yeah.
this was included in that, so it's
Okay.
not.
Yeah.
Okay.
Any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Collins, second by Mr. Miller, all in favor?
Aye.
Any opposed? Thank you.
Great, thank you so much. Have a happy Thanksgiving.
You too, thank you. Believe how quickly it came up on us. All right, now we'll move on to mental health. We have Dr. Giordano tonight. Good evening, Dr. Giordano.
Good evening, Mr. Chairman.
Moving on to number 4, authorizing an agreement with Teva Pharmaceutical Industries Limited regarding the New York opioid settlement funds.
Thank you very much. This is, as you might recall, I was here earlier this year for another settlement fund request. That was the Mallinckrodt settlement. This is Teva Pharmaceutical, and as we talked about, I think in the past, a lot of the litigation is still ongoing and some of the settlements are still yet to come. And so we were notified that this amount is $97,500 has come to the county to be added to our opiate settlement funds, and it's from Teva Pharmaceutical. I never even knew who they were until they sent us money.
I mean, just a drop in the bucket, that helps, right?
Well, yes, on both counts, yes.
Any questions from the committee, Ms. Moriello?
Just a quick question. In your letter, it says this funding is important in addressing the substance abuse prevention, treatment, harm reduction, and recovery service
Yes.
needs at the local level. What is done for harm reduction? What is that exactly?
It's one of the 4 areas that the State Office of Alcohol and Substance Abuse Services funds, and it is efforts to help people who might not yet be ready to stop using to be engaged in whatever services they're willing to accept to keep them alive, with a goal towards getting them off the drugs. And there are programs in Albany County that are already, Catholic Charities, for example, is a harm reduction program. So we have no schema yet for how this is going to be spent. There will be a process which the ledge will be notified of, and part of those are the 4 categories, though, that the state has for substance abuse services.
Thank you, Mr.
Any other questions from the committee?
Mr. Murray, I got mine again.
Hearing none,
Do you read
can we
my
get a
notes
motion-
ahead of time, right?
Hearing none, can we get a motion to move?
Motion.
Motion made by Mr. Miller, second by Mr. Ward, all in favor?
Aye.
Any
Aye.
opposed? Unanimous. Number 5, authorizing an agreement with Rehabilitation Support Services Incorporated regarding case management services for the county reentry program.
Right, so this is something that I've come to you and this committee a number of times over the years. We're one of 20 counties in New York State that were identified by the Division of Criminal Justice Services as a high-risk or crime county, and we have a reentry task force, and in that project, we subcontract with a local provider to do the case management services. This is a renewal. It's a second year of a multi-year contract, so this will go back out to bid probably either next year or the year after. So Rehabilitation Support Services is one of our contract agencies. In this capacity, they have 2 case managers and a peer working with people returning from state prison, trying to reduce their recidivism.
Thank you, Dr. Giordano. Mr. Morello?
Just another quick question. Do we know how successful this program is?
Yeah.
I'm going first next time, Frank.
Sorry? So, yeah, last year we served 84 people. The recidivism rate for the Albany County individuals was about 25% over the course of the year. The state average of the other 19 counties is 35%. And we have always been one of the top 1 or 2 of the reentry task force programs. These are folks that are identified as they're getting ready to be released as at high risk for rearrest. It's a voluntary program, so not everyone takes the opportunity, but I think relative to the other counties, we've been pretty successful.
Thank you.
Thank you.
You're welcome.
Mr. Miller?
Oh, he did it again.
Any other questions from the committee? Hearing none, can we get a motion to move?
Motion.
Motion made by Mr. Miller, second by Mr. Ward, all in favor?
Aye.
Any opposed? Unanimous. Number 6, amending the 2023 Department of Mental Health budget, administrative adjustments.
Yeah, so I'm coming to you tonight to request that we move $15,000 from a vacant social worker position into our overtime budget. And as you'll recall, I've been in front of you a couple of times this year with the same kind of request. This is basically for our mobile crisis team and our jail unit, which has to run irrespective of whether we can find people to staff it or not. And so we have run with a lot of vacancies in both of these programs. We've had to draw from other aspects of our department. And, you know, once again, we had to come before you and ask to reallocate money for our overtime budget. The goal here is to get fully staffed in both units. But whereas in some of our other programs, we might be able to say, well, let's just not provide the service for a while. We can't do that with either the mobile crisis team or the jail unit. So we draw from other elements of the department.
Sure. Do we have any questions from the committee? Start with Mr. Miller.
Don't have anything.
Good. Hearing none, can we get a motion to move?
Motion.
Motion made by Mr. Miller, second by Mr. Ward, all in favor?
Aye.
Any opposed?
Thank you very much.
Okay, last on the agenda, number 7, authorizing the renewal of a contract for reentry services with the New York State Division of Criminal Justice Services and amending the 2023 Department of Mental Health budget.
Right, thank you. So this is integrally related to the RSS item. There's a 3-year grant from DCJS, which is our reentry grant. We have a coordinator on our staff, and we subcontract out to the community for the RSS piece. Again, this is the second year of, I think, this is the second renewal of a 3-year grant, and we'll probably go back out to bid next year. We're asking to add $2,338 to the 2023 budget to make us whole. The grant runs from October 1st to September 31st, so we're just kind of cleaning up the end of '23 with the grant award.
Dr. Giordano, any questions from the committee?
Just a quick question is, how successful has this program been?
That's the same program.
Same, oh, yeah.
I'm sorry, yes. So the coordinator is a county employee, which is the way it is in the other 20 counties. We've elected to subcontract out the case management work, but the success of that program is really one entity, the reentry task force.
All right,
So
thank
it
you.
was 84 people last year with a 25% recidivism rate.
What's that? Okay, any other questions from the committee?
Motion.
Motion made by Mr. Miller. We get a second by Mr. Collins, all in favor?
Aye.
Any opposed? It's unanimous. Thank you. Dr.
Thank you very
Giordano.
much. I wish you all a happy
You
and
too. Thank you. Can you get a motion to adjourn?
Motion.
Made by Mr. Miller, second by Mr. Warland, all in favor?
Oh.